King 5 News. With Gene Emerson, Dennis Bounds, Jeff Renner First Alert Weather, and Paul Sylvie Sports. Number 1 in Western Washington, King 5 News at 5.
There has been some confusion and some controversy about vitamin D. How much do we need? How should we get it? So here's what doctors say. Of all the places on the planet, the far north would seem to be the most vitamin D deficient. Not true, thanks to the ancestral diet.
People who live in Alaska and even farther north on the planet, they still eat the liver of fish and wild game, and even further north, the liver of polar bear and seals.
Nutritionist Bev Kindblade says Americans stopped eating liver in the late 70s, and for good reason, toxins. But there was a cost.
We lost our significant food source at the same time we started putting things in our body that made it impossible for us to actually synthesize vitamin D in the summertime.
Sunscreen, plus dietary changes, plus living in the sun-starved Northwest, it's no wonder that we have low vitamin D levels, which have been linked to everything from cancer to obesity to autoimmune diseases like multiple sclerosis.
There's no question that MS patients have low vitamin Ds. The question is, did that cause the MS, or did the MS cause the low vitamin D? So it's still controversial.
Living here might be reason enough to take a vitamin D supplement. How much you need depends on age.
For children up to 12, 400 units a day is pretty reasonable. For people from 12 to older age, like 65, should be taking 800 to 1,000 units a day. And our elderly patient population, they're very good about avoiding the sun. They should probably be getting 2,000 units a day.
Dr. Ari Gilmore says muscle pains can be a sign of vitamin D deficiency, but not always.
In general, there aren't a lot of symptoms when someone's low on vitamin D, just a slow process of losing bone density over years.
A process that can start in childhood. 20 minutes a day outdoors in the summer is also enough to keep your vitamin D levels high enough. Any longer and you risk skin cancer. So use sunscreen year-round, even if you can't see the sun. If you'd like more about how weather and climate affect your health, join Jeff Renner and me tonight for Beyond the Forecast. Biometeorology, a big word, but it's all the ways weather affects our health. That's 7:30 right here on King 5 tonight.